Damn it, Leslie. That patient of ours had symptoms all over the place, man. I know you're trying your best, but come on.
I'm doing my best, Doc Hawks. I just don't think these 3 symptoms we got here really add up to Coxsackie overgrowth syndrome.
Oh, please. Do I look like a guy who doesn't have a clue? You guys better start believing in me.
All right, let's not get personal. But Doc Hawks, can we take a second and weigh the options here?
Yeah, Randall's got a point. Maybe we should just stick to the facts for once.
Fine. I know I'm right. So just do lithotomy already. What's wrong with you guys?
All right, Hawks. We'll get it done, but please don't be mad if things go south.
Mad? You think I'm mad? No. I'm just disappointed that you guys can't see this as clearly as I do. Boss, I need you to listen to me. Our patient has a condition called Coxsackie overgrowth syndrome, and it requires a surgery that can only be performed by an expert like me.
What is this shit? Some kind of alien disease? You're not an expert, Hawks. You have no idea what the hell you're doing.
That's why I want to perform lithotomy on him. It's a procedure that can be used to treat this condition and save his life.
Save his life? By screwing up your patient even more, maybe?
I assure you, boss, my skills are unmatched in the field. This is the best course of action for our patient.
You're really going to make me regret this conversation, Hawks. But fine, do what you want with your patient. Just don't drag us into another clusterfuck of a situation because of your lack of judgment.
I'll make sure that doesn't happen, boss.
I can't believe this, Hannah. The patient is in critical condition and you're not taking it seriously enough.
Calm down, Randall. We'll get through this. I know the lithotomy was a mistake, but we have to be careful with our decisions.
A mistake? It was more than just that. The patient has Coxsackie overgrowth syndrome and you knew it wasn't suitable for such a procedure.
I know, Randall. But Dr. Hawks insisted on the lithotomy despite knowing the risks. We should have taken into account his diagnosis.
Well, we didn't take enough precautions, Hannah. Now our patient is in critical condition and we're stuck trying to find another way out of this mess.
I understand your frustration, Randall, but let's not blame each other for the situation. Let's focus on finding a solution now.
My solution would be climbing out of this window with the bed sheets. You keep watch.
I thought you were supposed to be the cool-headed one around here. Maybe you really are turning into a great value version of Hawks.
You 3 are a bunch of blithering idiots. Lithotomy was not the correct treatment for this patient, and your misdiagnosis nearly cost them their life. Don't you see how dangerous it is to make such reckless mistakes?
We're sorry, Doctor. We had good reasons to believe that Coxsackie overgrowth syndrome was the diagnosis.
Oh, please. Good reasons. Your so-called good reasons led you down a path of sheer incompetence. You should all be ashamed of yourselves.
But what do you think the correct diagnosis is? We're willing to listen and learn from your insights.
The correct diagnosis, you ask? Let me tell you, it's not rocket science. This patient had a simple case of indigestion, but no, you had to complicate matters with your wild guesses.
We understand if you're upset, Dr. Hawks. We'll make sure to take extra care next time when diagnosing our patients.
Take extra care. Take extra care. That's not good enough. You should all be taking extra precautions. Next time, don't rush into a diagnosis without having all the facts straight.
Next time I'll make sure we ignore literally everything you say. Maybe we'll get it right without you.
How much did Randall pay you to say that?
She speaks with honesty. I didn't have to pay her anything.
$200.
Wow. You think she's that cheap?
That was as low as she'd go.
No refunds.
I officially hate all 3 of you now. Welcome to the team, Hannah. Well, Johnson, it sounds like you're doing a great job with your patients in oncology.
Thank you, Hawks. It's always gratifying to see the progress they make, even if it's not always linear or predictable.
Indeed. But tell me more about this one patient of yours who seems to be proving more challenging than usual.
Yes, that would be Mrs. Smith. She's been through quite a lot recently, and her cancer is proving difficult to treat. It doesn't seem to respond to any conventional treatments.
The cancer is Mr. Smith, isn't it? You sly dog, you.
No, I don't get attached to my patients.
Speaking of cancer starting with misters, I've been thinking about my patient, Mr. Jones, who's been experiencing similar issues.
Really? What's your diagnosis?
Well, it seems he might have an unclassified type of cancer. It doesn't react to known treatments and keeps mutating. The more we try to contain it, the faster it spreads.
That sounds like quite a challenge indeed. I hope you find a solution soon.
I can't believe you guys are so caught up in protocols that you forgot the real problem here.
The real problem is you not following proper medical procedures.
And that's exactly why we have protocols, to prevent situations like this one.
So now, tell me, Hawks, how do you diagnose Goucher's disease?
Well, Randall, it's quite simple. I had lunch with Dr. Johnson and he confirmed the findings from my research.
And how did you come to that conclusion over lunch?
That's not the point here, Leslie. The point is Hawks disregarded all safety protocols for his own convenience.
You boneheads. The point is the patient, not the protocols. What's the prognosis of Goucher's disease?
A shorter than usual life expectancy if it's type 1, death in early childhood if type 2, and dead before 30 for type 3.
Which type does the patient have?
Well, look at the patient. Guess the age. That should give you a clue.
Guess we can rule out type 2.
After yesterday? No, I don't think we can based on Hawks' logic.
I've said it before and I'll say it again. You're a genius.
How much did Hannah pay you to say that?
I'm pretty expensive. I don't settle for anything less than 5 figures.
Well, come on. Where else did that counterfeit bill come from?
Counterfeit?
Yeah, she knew you wanted that 200 she took from Randall pretty bad.
How would you know about any of that?
You asked us to improve our security around here, and I was able to find that she used the copier at the nurse's station to copy the same $100 bill she got from Randall. Given she made about 6 copies. Not even 4 figures. You really think of yourself that low, Hawks.
One of these was going to be for you.
Get the ever-living fuck out of my office.